Are you experiencing variation in your blood pressure readings? Let's understand how our body works. It's the most important to note that everyone's blood pressure varies throughout the day and is influenced by a number of factors. For starters, all humans have a natural daily rise and fall in blood pressure that corresponds with their circadian rhythm. For most people, blood pressure will be at its lowest in the early morning hours and then rise through the late morning and peak in the mid-afternoon. Typically, this range will be about 10 to 15 millimeters of mercury on the upper or systolic valve, which represents the peak pressure in the arteries, and 5 to 10 millimeters of mercury on the lower or diastolic value, which represents the lowest pressure at the resting phase of the cardiac cycle. Thus, a person with a resting blood pressure of 125/70 at 3 a.m. might have a reading of 140/80 by late afternoon. The second reason is hypertension, a condition characterized by chronic high blood pressure. When a person has a history of hypertension or if the blood pressure has not been well controlled over a period of years, then the vessels themselves become more reactive, meaning they tighten up with less provocation than they would in an average person. One of the manifestations of poorly controlled blood pressure is a high degree of variability. A person with a lot of variation could easily have a blood pressure of 140/90 in the morning and a reading of 200/100 later in the day. Third, stress, emotional upsets, and food sensitivities can cause an increase in blood pressure. Someone who is salt sensitive, for example, could get a double-digit boost from a big dose of salt. Tobacco use or use of recreational drugs can also cause a spike. On the other side of the coin, alcohol, cessation of exercise, and a warm environment can lower blood pressure. Fourth, there are two phenomena which we should be aware of. First is known as white coat hypertension, in which the stress of a visit to the doctor's office causes an elevation in blood pressure. The second is masked hypertension, where on the other hand, patients have normal blood pressure readings at the doctor's office, but the experience increases in blood pressure at other times of the day or in different settings. Patients with certain chronic conditions such as diabetes and kidney disease are at risk, an increased risk, of developing hypertension and masked hypertension. 5. Using on the wrong arm or tying the cuff incorrectly. Blood pressure measurement values vary from the left arm to the right arm, and the average is generally within 10 millimeters of mercury for most individuals. Blood pressure monitors are generally designed for use on the left arm only, so please read instructions for proper cuff use and tube position before using. Hypertension, which is partly genetic and tends to increase with age, can usually be controlled with proper medical attention, diet, and exercise. Please check your blood pressure on a regular basis with your Dr. Trust BP monitor and review the overall trend of your blood pressure readings with your doctor.
Dr. Trust. Trusted for life.